I'm James Cireddu. I'm a physician, cardiologist, invasive cardiologist with University Hospitals of Cleveland here in Cleveland, Ohio. I'm also CEO of Telehealthcare Solutions, who makes virtual physical exam or VPExam. And we recently were at the Heart Rhythm Society HRX conference, and we're excited to discuss our VPExam platform there for virtual care. We deal with a lot of barriers to care in cardiology, especially transitioning care from the inpatient setting to patients going home. And some of the biggest issues are patients who have barriers to come in and see us. And telemedicine is a good solution, but we often lose the physical exam components like jugular venous distension, lower extremity edema, a heart and lung examination with regular telemedicine. So virtual care like VPExam can add back all these physical exam components that are really key to successfully managing, especially our heart failure patients, but any of our more complex cardiopulmonary kind of patients. So VPExam stands for virtual physical exam. It's a combination of technology, a platform with an app, and it uses augmented reality overlays to pretty much walk any user through how to perform a physical exam that's been customized by the physician or the cardiologist. And it'll use augmented reality to appropriately position cameras, look at things like jugular venous distension or extremity edema. Then we connect to Bluetooth-enabled stethoscopes like Littmann or Echo Health Duo. And some stethoscopes also have things like an ECG, a single lead ECG. So we get a full heart and lung exam, and it walks the user through where to position the stethoscope to make it very easy, and again, customizable by each different physician. So we have different specialties using it, from cardiology to pulmonology to nephrology to critical care and primary care physicians who could make the physical exam data meaningful to how they're managing their patients. But really the innovation is opening up physical exam technology all the way from nurses to medical assistants with minimal training, but also patients' family members or even the patients themselves to be able to transmit that kind of data to their cardiology, both for follow-up visits or for more urgent visits. So VPExam Quality Improvement Project was really focused on transitions of care. We were looking at our sicker heart failure patients who had BNPs above 300, EFs below 40%. We were really focusing more on our higher risk readmission type patients coming into our hospital system. And what we did was we identified them during their hospital stay, and then we used the virtual care product VPExam to follow them into their skilled nursing facility or to their home healthcare environment, where nurses can bring the telemedicine platform with them into the patient's house and can perform full physical exams on them during their follow-up within the first 1 to 2 weeks of discharge. And we found that this really helped overcome a lot of barriers to these kind of patients getting good quality follow-up by a cardiologist. And the additional data, we also can do full histories using voice recognition, review of system, medication reconciliation. And we also have a document scanning side of the platform. That, with the physical exam, we utilize to see how big of an impact that would have on these patients' care as they left the hospital. And over the course of the study, it's become increasingly clear that we can reduce the 30-day readmission rate over 40% during this pilot, and then even the 30-day mortality rate for these high-risk patients dropped by approximately 56% compared to our historic controls. The other really interesting thing was, after we got the platform into our workflow within our hospital system, for the first 1 to 2 months, we were pretty close to our readmission rate prior to initiation, but by month 3, 4, 5, and 6 of this pilot, our readmission rate for heart failure dropped to 0%, which I think is a fairly clear indicator that this platform is making a significant difference in these patients' discharge planning and follow-up. So the key findings of VPExam QI are that we can provide 100% compliance with follow-up, which is often a big problem, and we're following very sick patients. Even nursing homes can often be a difficult place to get patients to follow up from. So our compliance with follow-up in this pilot was 100%. We had no significant technical problems, meaning the platform perform both for the nurses and medical assistants using it and for the physicians using our portal to review the data. And as a telemedicine platform, it worked very well. And then big picture, that the physical exam data did very significantly change the way we managed our patients. That having additional things that VPExam adds that regular telemedicine doesn't, changed our management very significantly. Volume status changed management 47% of the time. Cardiopulmonary auscultation changed management 33% of the time. Arrhythmia detection with the ECG side of things changed management about 14% of the time. So that these extra pieces of information that virtual care gives us above regular telemedicine really changes how we care for patients. And that we think that that clearly had an impact on reducing our 30-day readmission rate by 40% and reducing our 30-day mortality rate for these high-risk heart failure patients by over 56%. And that's an exciting platform that scales very quickly. We're part of a large hospital system with over a dozen hospitals, and we have over 50 post-acute care quality network nursing facilities who are part of our network, and that we can deploy this kind of technology very quickly and inexpensively, because it really is just a combination of a smartphone or tablet being connected to a Bluetooth-enabled stethoscope with ECG, and really using the software and technology to make this very time efficient, both for the nurses who are the users or the medical assistants and the physicians reviewing the data. Making sure it works into their everyday clinical workflow is fairly key, so we can deploy this across a very large area. Yeah, so we've had a lot of increased interest from physicians utilizing VPExam, and our starting point has really been this focus on transitions of care. So I always invite physicians to reach out to me, healthcare leadership. We can deploy VPExam into skilled nursing facilities and into home care agencies very quickly and efficiently. We have a training team that helps with that. And then physicians can utilize our freestanding cloud-based portal that works off of pretty much a browser like Chrome and even is functional from a mobile device. And this is a full telemedicine platform that also allows you to review the physical exam, but also pulls in patients' health kit data. So they have Apple Watches, they have Bluetooth blood pressure cuffs and scales. It will pull in all that data as part of their telemedicine encounter. So that's the other side of it. We have a lot of users who are using this for transitions of care, where they're using this on higher risk patients at risk of readmission, heart failure, acute MI, significant arrhythmias. We also have pulmonologists using it for COPD and pneumonia, and even nephrology has been using it for volume assessments. But beyond that, everyday patients can benefit from sending health kit data to better improve things like blood pressure management and AFib detection and things like that. So the future technology, we're continuing to make additional partnerships. We're always looking for health systems who are interested in adopting this kind of virtual care technology that's very efficient to scale and has a lot of downstream financial and quality benefits. So always looking for health systems who would like to adopt this kind of technology. We're also extending our partnerships. We just recently partnered with G Medical Innovation, who makes event monitors and MCOTs that actually pair up with our technology very well. So we're moving to partner with different device manufacturers. VPExam was really built to add new kinds of devices and remain fairly agnostic. So any device partnerships that physicians are looking for to improve the quality of their clinical care are the kind of partnerships we're looking for. There's also been a lot of interest in utilizing VPExam for decentralized clinical trials, which I think is an exciting use of this kind of technology, where you can use virtual care to enroll patients in more remote areas and then follow them more closely to look for side effects of pharmaceutical trials, especially decompensations and things like heart failures, arrhythmia, things like that. VPExam is very good at letting patients who don't live next to large academic medical centers or urban areas and still make sure that they get to be represented in these newer clinical trials. So we're happy about the expansion on that side. And then a little bit of a passion project for me has been using VPExam to help teach our next generation medical students and residents how to utilize physical exam data to optimize their patients' care. So we've been increasing using VPExam both in medical school and residency training.